Hey there, Dr. Peterson here with Regions EMS, and guess what? It's time for another COVID update. Today is Wednesday, November 18th, 2020. I know it's been a while. We kind of got into a groove over the summer. It seemed that things had settled down in our area. Felt like things were going pretty smoothly, but obviously now we've taken another turn. The virus is back in a very alarming way. We thought it was time to check back in, let you know where we're at as a medical direction team, things that we're thinking about, that we're looking at, and just things that you should be aware of over the coming days and weeks. We'll try to put out these updates as often as we feel there's enough information to put out. So let's bring you up to speed. First of all, the numbers that are being reported are very difficult to interpret and compare. COVID, we're reporting actual hard data. Whereas other things like influenza is based on estimates and models because we really don't do the same amount of testing for influenza that we do for COVID. So the case numbers and the death rates for influenza are estimates, whereas the COVID data is actual numbers. So, can you compare them? I guess you could, but you just have to keep that in mind, keep the context in mind. What we know for certain, though, is what we are seeing. So you can argue how severe this is relative to other diseases. But what we are seeing are record numbers of hospitalizations, record numbers of deaths due to this virus. This is a very real virus. It is not typically dangerous for most people, but it is very dangerous for a few people. And we are seeing some very alarming numbers in the hospitals because of that. So worldwide right now, we're just over 55 million confirmed cases and about 1.3 million deaths related to COVID-19. These maps almost aren't even worth anything anymore because everything is just red. Here in the United States, we've just crossed the 11 million case mark, and we're at almost 250,000 deaths. And if you look at this heat map here, you can see where the current outbreak is right where we live, upper Midwest. Minnesota, we've seen just over 237,000 or just about 237,000 confirmed cases, and we're approaching 3,000 deaths related to COVID-19. Just across the river in Wisconsin, you've seen 325,000 cases, but only 2,700 deaths. So a little bit interesting that there's been more cases and actually a little bit less testing in Wisconsin, but fewer deaths. So just an interesting comparison. I don't think it means anything. But then how does this compare to other pandemics? And if we just go back a few years to the swine flu or H1N1 outbreak in 2009, 2010, it's estimated that there were about 200,000 deaths worldwide from that outbreak. And like I said, right now we're at about 1.3 million. So this is significantly worse than anything we've seen in recent time. The Spanish flu outbreak is the other comparison that people have made back in 1918. And that killed nearly 50 million people worldwide. So fortunately, we're not anywhere near that number. Hopefully, we don't get anywhere close to that number. But this is a very real and a very dangerous virus. Outbreaks, as far as the contact tracing that the state has done, they've really narrowed in on bars and restaurants. And they feel that the later evening hours are kind of the prime time when this virus is being spread out in the community. What's interesting is that it's not being spread as much in schools. There was a lot of fear about schools causing huge outbreaks, and at least the lower level grades don't really seem to be spreading the virus. Definitely on college campuses, we've seen quite a few outbreaks, but it really is happening in those really tight, close social settings. My theory is that it involves food. I don't know if that's, there's no data to back that up, but I really think that that's one of the riskier places where we're sharing food and sharing same close environment with other people. It seems to be spreading a little bit more easily in those environments. So what do we know? We know that the PPE works. What you're wearing is working. We are not seeing outbreaks amongst healthcare workers that are related to patient care. Any healthcare workers that have tested positive, at least in my circle of healthcare, have been from community spread, not from patient contact or patient spread. So the N95 masks, even the surgical masks, the gowns, the eye protection, the gloves, all of that is working, and we don't seem to be failing ourselves in the way that we're protecting ourselves. So continue what you're doing. Everyone seems to be doing a good job. I think the key, though, is you have to remain vigilant. We can't let our guard down. It's more likely to be spread in the station, in quarters, when you're sharing a meal together. So just, you still have to take precautions, social distance, wear masks, even in between calls when you have downtime. We don't want any of you to go out on quarantine or sick. That would just devastate our staffing here in the East Metro from an EMS and healthcare standpoint. So stay vigilant. That's the best encouragement I can give you at this time. Things that we're anticipating that we're working on plans for. One is staffing, like I mentioned, both in the hospitals and pre-hospital environment. How are we going to backfill people when we have mass numbers go out either on quarantine or sick, actually, with COVID symptoms? So there's some things in the works. I know that FEMA is sending 25 ambulances to Minnesota. That's primarily to help with inter-facility transports, not 911 calls. So it's there's a number of options, number of things in play, and with the governor's extension of the peacetime emergency powers, again, the EMSRB statutes are temporarily suspended. So we do have a little bit of flexibility if it gets to the point that we need to take advantage of that. Supply shortages, we seem to be doing okay right now. I think the PPE production has caught up, but we're keeping a very close eye on that. And our team at Regions EMS is working on sourcing from as many options as we can to make sure that you are always supplied with the right PPE. Other things that we're starting to see very real is ER overcrowdings. Hospitals are completely full, bursting at the seams, record numbers of hospitalizations. As you can see on the graph here, it's just almost exponentially increasing, significantly more than what we had earlier this spring. That's overflowing then into the EDs. We're boarding patients overnight, sometimes in the ED, waiting for an inpatient bed, which then causes delays in you offloading patients at the ED. And so I see that problem getting worse. So we're working on trying to be proactive there. But unfortunately, we're just kind of stuck with the numbers game at this point. There's just too many patients and not enough beds. And then I mentioned the hospital bed shortages. So best practices for now. What we know as far as treating these patients, really oxygen is about the only thing that's going to help them. You can, if they're really struggling or having trouble getting their O2 sats up, you could, if they're willing, self-prone them. Just ask them to lay on their stomach on your stretcher. You still have to adequately restrain them for being in the back of a vehicle, but that does sometimes redirect blood flow to the healthier parts of the lungs that are able to exchange gas a little bit easier and can improve their oxygen levels. Avoid CPAP unless it's absolutely necessary. Really, if somebody's going to go on CPAP because of COVID-19 symptoms, they probably just need to be intubated. Continue to avoid nebs. That's really not a wheezing component to COVID-19 unless there's some other underlying lung disease. So just know that both of those, CPAP and nebs, are highly aerosol generating procedures and increase the risk of transmission to you and your team. Intubation is also a high risk, but if the patient needs it, they need it. Just take extra precautions. Make sure you're wearing a full face shield in addition to the eye protection, the N95 mask, and the gown. And then also one thing we know is that IV fluids or too much IV fluid resuscitation can be harmful for patients with COVID. So unless they seem really clinically dehydrated or hypotensive, let's try to limit the amount of IV fluid that we're giving to these patients and let us sort it out at the hospital to decide how much they should need based on some laboratory markers and other things that we have access to. So that's it for now. You can check in at our website, regionsems.com. Right on the front page there's a link to our COVID resource page that still has a lot of good information. We'll go through that and make sure that that's all updated. And since we're going to be starting this up again, I figured let's bring back our weekly or daily trivia. Not sure when the next episode will go out, but for those of you who were participating last time, you can send your best guess to regionsems@healthpartners.com. So today's question: in the last 100 years, what disease outbreak has killed the most people worldwide? If you have a guess, send it into regionsems@healthpartners.com. Otherwise, also feel free to send in any questions that you might have that you want addressed in future updates. Otherwise, thanks for watching. Thanks for all that you're doing. Stick with it. We have a vaccine in sight. We're almost, there's a light at the end of the tunnel at this point, but just stick with it, be vigilant, stay safe, and we'll see you next time.